Hello, my name is Roshanak, and in this presentation, I will discuss my research topic, enhancing and extending the accessibility to health services in rural Australia by the introduction of internet-based technologies. In general, I would like to investigate enhancing and extending the accessibility to health services in rural Australia by proposing a website. According to a paper from John Humphry and John Wackerman, there is no one model capable of servicing the health needs of diverse rural and remote communities. Moreover, many small rural and remote communities require alternative approaches to healthcare and models of health service delivery different to those which have traditionally characterized rural Australia. The tyranny of distance and lack of transport are major impediments to accessing healthcare for many rural Australians. For many people, the cost of travel is a major barrier to healthcare. Poor roads and lack of public transport represent the most immediate problems. In Australia, nearly one-third of our national population, approximately 7 million people, live in rural and remote areas, and 15.1% of the population is people of 65 years and above. It's estimated that on an average, 63% of people are deprived or cannot access a medical facility or a medical resource in rural Australia. The diverse population suffers from many diseases, and 30% of them remain unnoticed and unattended at critical stages due to less accessibility of health resources around them. Health workforce shortages and maldistribution and higher out-of-pocket expenses in more remote areas makes the problem worth investigating. In the current healthcare system, there is no one model capable of servicing the health needs of diverse rural and remote communities. Long-distance medical assistance is still a shortage. There is only one helpline number and also no tool to visually analyze the present scenario. The raised question for the problem is, what is the impact of proposing a website for health system on the financial restriction in the rural medical setting? The question will be answered through literature review, data collection, propose the model, which is website, design of the proposed model, and testing the model. After doing the research, we need to make sure the research question has been answered. So it will be done through report, outputs of the research, and conclusion. I want to propose a website to the healthcare system which provides any long distance immediate medical assistance and enforce some changes to the current facilities. A system would analyze the problem with the current situation, provide assistance and support to the needy, and help rural people have a better living. The proposed model will have a major impact on the way to approach and enhance the availability of health services more efficiently and conveniently. The new knowledge of this research is finding information about present healthcare system in rural Australia, lack of the system, advantages and disadvantages, and proposing a model which covers shortages of the present system. The tyranny of distance and lack of transport are major impediments to accessing healthcare for many rural Australians. So proposing a website for healthcare system will reduce expenses of workforce and also the cost of transport to medical center in many cases for rural people by accessing web-based medical assistance.